Now for our special campaign, Vaccinate India, in partnership with Google, where we bring you frequently asked questions about COVID, about vaccines, questions that a lot of you often Google. And joining us to answer those questions is Dr. Rajesh Parikh, Director Medical Research, Jaslok Hospital, Mumbai. Thank you so much, Doctor, for joining us. And one of the questions that people are looking up a lot is how long does it take to develop immunity after the COVID vaccine?
Hi, Gargi. That's fairly straightforward. The general consensus across the world, across different vaccines, is on an average, it's about 2 to 3 weeks. But I think it's important for us to realize that when we talk of a mean or an average of 2 to 3 weeks, it means that there are people on either side of that average. There are some people who might develop it in as little as a week. On the other hand, there are people who might even need a month. And so I think as a rule of thumb, we advise people to consider that the immunity will come in after a month. That way, they're playing it really safe.
Right. And even once you're completely vaccinated, Doctor, it's important to continue, being careful, because it doesn't mean you're 100% protected.
Absolutely. And I think as you indicated a few minutes ago in the ICMR survey, that while it does offer you protection, considerable protection, I might add, against developing serious illness, very few people develop serious illness, it doesn't give you total protection against getting infected and moreover, passing on that infection to other people.
In fact, we're going to come to that question. And just one more question I wanted to ask you about this issue of immunity is also how long does it take for the immunity to wane? Because that's become the focus now, with many people having been vaccinated for several months and, this immunity erosion.
Yeah, Gargi, I knew you're going to have a tough question, starting with the easy ones first. But, that's something we don't really know because we're chasing the virus. We are learning as we go along. What we do know this far is about 6 months. It might be longer. And just 2 days ago, there was a bit of illumination indicating that it may even be lifelong, at least with one of the mRNA vaccines. I wouldn't bet on that, though.
All right. So another question that people look up a lot and something you just mentioned is, can a vaccinated person give COVID to unvaccinated person?
Yes. However, that's a more nuanced question. By and large, minimally. So there is some degree of protection about transmitting the virus, but that depends and varies, in fact, from vaccine to vaccine, from mutant variant to mutant variant. We know there are the alpha, beta, gamma, delta variants, and for each of them, it's a little different. It also depends on the individual, and as you illustrated a little while ago, it also depends on herd immunity. It's important for us to realize that only 6% of our country is fully vaccinated. The others are partially vaccinated, about 29%, but
right.
That number is low, so we are a long while away from it. And the other thing that bothers me, Gargi, is I just noticed in some of the visuals you showed that people are standing very close to each other, and a lot of them are unmasked. I saw the stampede that you showed, and this has happened in other countries where the vaccination sites actually became super spreaders. So
I think it's happened here as well. During the second wave, I think a lot of people got COVID when they went to vaccination centers and, not enough care was taken, as you pointed out.
So that's very, very important, Gargi, when we're talking about the spread of the infection. Overall, the news is all good.
All right. So the vaccinated person can give COVID to the unvaccinated. But currently, the worry is about the rate of vaccinations in the country. And that's something that we want to improve, especially if we're trying to ward off a possible third wave, isn't it?
Oh, absolutely. I mean, that's totally undeniable. So just to come back to what you kind of raised along with this, it's very important for vaccinated people, for their own sakes and for the sakes of other people, to continue with all the precautions, particularly the masking. And yes, of course, we have to press the accelerator on the vaccination program across the world in the current pandemic. And historically, it's been unequivocally demonstrated that that's the one thing that works.
Absolutely. Thank you so much, Doctor, for joining us on the program.
Thank you, Gargi.
Thank you.